All right, as we get older, let's face it, things change physically, mentally. But what if there was a way to better identify issues and be able to stop them in their tracks? Naturopathic physician Dr. Kelly Miller from the Miller Clinic for Optimal Health is here now with more on this. All right, good to see you again, doctor. I always learn something when you're here.
Good to be here.
Let's talk about genetic testing and specifically epigenetics. What are we talking about here?
What we're talking about is that we get half our genetic material from mom and half from dad. And mom or dad may have a gene variant that increases their risk and subsequently our risk for cardiovascular disease, cancer, diabetes, Alzheimer's. And the expression of that gene variant is called epigenetics. So in gene testing, what we're able to do, if we find this variant, is that we're able to alter our diet by simply supplementing a specific nutrient. It could be vitamin D, C, B, whatever, and this will negate that gene variant and negate the epigenetics or the disease form.
So we're talking about some cutting edge stuff here. Nobody else is doing this. And what you're basically saying is with genetic testing, you can find out what to do and what to give someone in order to prolong their life, maybe prevent a disease from happening. Is this true?
Absolutely. If I had a child today, I would be doing genetic testing on him to know what to feed them. Yeah, for example, how this can prevent, there's so many different ways. If we look at the weight management genetic testing, if we just know what proportion of fat, carbohydrate, protein each of us should eat individually to keep us leaner, and also what exercise is best for us to burn body fat, then we reduce body fat, which causes inflammation. Excess body fat causes chronic inflammation. Chronic inflammation is a precursor for all illness. So therefore, if we have less inflammation, we're going to have less chronic disease.
Okay, now you mentioned genetic testing on children, but you're doing this on adults.
Yeah, well, most of our patients are middle-aged and beyond.
And what are you finding when you do the genetic testing? How are you helping them?
Well, like I'll use, for example, in my particular case, when the genetic testing I found.
So you tested yourself?
I tested myself,
okay.
Sure. I have 2 B vitamin variants, which is very common because actually 22% of the population has a B vitamin variant. This is very critical because if I didn't know this and I didn't take more specific B vitamins, in fact folate, B12 in my particular case, it would put me at increased risk for cardiovascular disease and prostate cancer, and if I were a woman, breast, uterus, and ovarian cancer.
So when you do this testing, you find out something very simple. Well, you may need more, like you said, B vitamins. You may need more of X supplement or Y supplement. So we're not necessarily saying, oh, you're going to have to take another prescription drug. You're going to have to add this to your regimen. This is all very healthy and natural, isn't it?
Right. We just know that we need more than the average bear. If you have this B vitamin, I've got to take a lot more B vitamins, and I take them in a certain form, sublingual and with liposome technology for better absorption. So knowing that knowledge, you can prevent that epigenetic expression.
A natural way of hopefully preventing something very terrible, a cancer or another disease.
Yes, absolutely. Reducing your cardiovascular risk, diabetic risk, and cancer risk.
Dr. Miller, this is very exciting. Really, really excited to know about this. And for more information, you can go to his website, which is drkellymiller.com, or you can call the number on your screen, 813-774-3744. And Dr. Miller right now is offering a special 50% off. That's right, 50% off the first visit for new clients. We'll be right back. Thank you, doctor.
Thank you.